It is election year, and we heard one real good theme which was started by Mr. Robert Kennedy Jr. regarding making America healthy again. I'm not sure it's a rhetoric or he meant it. President Trump echoed with him. My concern and initiative to make this podcast was based on a physician who guides both of these gentlemen, Dr. Casey Means. I have read her book, which has a beautiful concepts, but I found that she is not in trenches. I've been a primary care physician for the last 27 years, and I have been doing value-based care for 15, which means I have experienced firsthand why America is not healthy and why we need to make it healthy again. A lot of trailblazer physicians like Peter Attia, Dr. McCarthy, Dr. Campbell, they have understood this problem at a very deep level, and they have a very deep understanding about the problem. United States spends $3.8 trillion on healthcare budget, and out of which about 95% and to some estimates 97% of it is spent on management of chronic diseases and complication of chronic diseases. The key players in this whole healthcare delivery model are policymakers, health insurances, healthcare delivery models, physicians, individual patients and their families. If we want to have a comprehensive reform of this disaster which we have on our hand, and yes, America is not healthy at this time, we must work diligently to look at all components and all players and understand where negative incentives are built, and we correct that. Is it a rhetoric or there is some thought? Because by nature, I'm not skeptical. I truly believe our leaders represent what is good in our society. But I have been criticized many times for this belief. I want to believe that they mean what they say because they are our leaders. And they are the one who have a power to make systemic changes. Let's understand all the key players. Policymakers must promote healthy lifestyle, and they need to incentivize healthcare delivery model for keeping patients healthy. In the last 5-6 years, we have been talking about value-based care, and there is some work done in that field. But I could tell you that we have been doing it for the last 15 years. I have not seen any major improvement. A lot of physician practices, they do this kind of work for the love of their life and out of gratitude to their patients and whatever their other motivation is. But our system does not incentivize for us to keep you healthy and keep you live long, happy life. Dr. Peter Attia has come up with a model of evolution of medicine, which I think I followed it subconsciously, but he articulated so well. He coined that we have medicine 1.0, which was being practiced about 100 years ago, which was completely observational, where wise people collected some observational data and they knew this work, whether it was herbs, exercises, routines, or whatever their observation was, they collected that data and put it into practice and they healed us. But it was very primitive and crude and observational only. Science is something which is reproducible, and we could produce a result effectively all the time, every time. That led to medicine 2.0, the era we are in. We are treating disease, and there is nothing wrong with it, because without medicine 2.0, where science understood disease processes, come up with pharmacological treatments, surgeries, and prevention techniques, without that, we will never reach where we are. So I truly believe it has done its purpose. As we have become more matured and we understand disease, both acute, chronic, and preventive care diseases, we have come to realization that chronic medical problems or the chronic diseases are the one which are really bankrupting us. See, $3.8 trillion every year, and out of that, what has is produced, 60% of US has at least one chronic medical problem, and 40% of us have more than 2 chronic medical problems, requiring on an average 4 to 5 prescription medications. And these chronic medical problems lead to 70% of the deaths: heart disease, cancer, COPD, stroke, diabetes, chronic kidney disease, Alzheimer's disease, arthritis, hypertension, and asthma. These are the 10 most common diseases in the United States and most of the developed and developing world. These all problems are coming from chronic risk factors, unhealthy lifestyle and behavior, leading to chronic diseases and chronic complications. We'll explore that. Out of 3 facets of healthcare: acute care, chronic care, and preventive care, United States outperforms anybody in acute care. If you have acute medical problem, meaning if you're in an accident, you have a gunshot injury, you have a heart attack, you have a stroke, if you are on this land, chances are we will not let you die if you make it to the hospital. But the irony is, being so good at acute care, we are a total disaster and failure in chronic care and preventive care. And the reason this thing happens is because our incentives are not aligned. Our policymakers do not understand the deep-rooted problem in trenches. Advisors to these political authorities have no understanding of real America. There are few trailblazers, Dr. Atiyah, Dr. McCarthy, Dr. Campbell, who really understand, and they are doing everything to change the paradigm of healthcare. In the United States, out of total healthcare budget, only 1.8% is spent on preventive care and about 8% is spent in primary care. Any system which has produced consistent results and have controlled chronic medical problem must be based on quality primary care, which is driven by prevention and availability. We have scarcity of primary care physicians, and also they are not compensated at a level of other specialties, leading to that young kids, they are going more and more into specialty care and very few generalists, and we are not producing quality physicians. Your primary care physician is your friend. He's the only guard you have. Primary care physician will have a relationship for a long time. They will understand you at the level the way you are. They will understand your personal lifestyle, behaviors, risk factors, and they can provide you with individualized health plan and treatments and procedures and advice which will change your life. Your primary care physician is the one when you're sick, you could call and you could claim that he's your doctor and he will see you. Primary care is the one who should guide you if you need a specialty care. If you go from our offices that you come and see to primary care and primary care evaluates you and he feels you need a specialty care. He creates a referral, sends with proper documentation to specialists. Your specialist will know why you are there and you will get real care what you need. Unfortunately, most of the commercial insurances, the care is not coordinated. We make willful attempt to coordinate your care. Still find the patients who are under PPO plans or commercial plans without going through primary care physician. They are going to the specialists and one specialist is referring to another specialist and nobody knows the whole. That is a real disaster. Without quality primary care, America will not become healthy. At the level of policymakers, they need to change the healthcare payment system in a way which is aligned with the desired goal. That is making you healthy. And you could become healthy with quality primary care and improving your lifestyle and your behavior. If these two things are not modified, we could talk about a lot of stuff, but I don't believe you will produce a result. United States in general, when it comes to health, they are bike shedding. That's a principle which was used when they were building atomic reactors, and they were more concerned about the sheds where they are going to park their bikes rather than how well they are going to make the atomic reactors. Unfortunately, we talk about trivialities, whether we should take this medication, that medication, or what is the extra 1% side effect you may or may not get. And we get lost into the details and trivialities. And we do not really come to a real matter on hand, the problem on hand. We are lost in trivialities. Further, when we are trying to do that, we are hubris. We are trying to do everything. Pareto's law says that 20% of change will produce 80% of the result. Let's get 80% under control. Let's not worry about everything. If we get 80% under control and you have the wheel moving, America will become healthy again. Out of healthcare spending, 25% is going to entirely to the inpatient. And if you look at it, next is cardiology, oncology, and all the specialty cares, but very limited to preventive care and primary care. And those should be the pillar, because we have built a system which is catered towards taking care of the disease and not preventing it. You will not change unless your dollar where it flows changes. If you are paid to replace joints, you will find a reason to replace people's joint. If you are paid to put stents, you will not prevent atherosclerosis and unhealthy lifestyle, because our policies incentivizes disease payment and not prevention. And then healthcare delivery models, they are overbuilt. A town of 35,000 people will have 2 hospitals. Do we really need it? If we do a good job in primary care offices, take care of the risk factors, prevent chronic diseases and chronic complications, why do we need so many hospitals? Why can't we reroute that dollar for prevention? There's no question individuals, patients have a full responsibility into that. Social norms have changed, and those norms are leading to a big problem because there is no individual credibility. We are not holding patients or individuals responsible, and we are not as irresponsible as we are with our healthcare. As in United States, we do very big things and we do it damn good. But our goal when it comes to health, we somehow are relying on a pill or a procedure. If we are obese, we need Ozempic. If we have a cholesterol, we need a Crestor. But we are not going to change ourselves. And that mindset must change. To live healthy, We must educate people about longevity, which involves both longevity of life or lifespan, how many years chronologically you could live, and life health span, how good you live. If we do not incorporate both lifespan and health span in educating people, we will not produce good results. We must change the paradigm from treating disease to prevention, individualized care, and incorporate technologies. Each prescription costs on an average per year $1,300-$1,400, and an average American is taking 5 to 6. How come we cannot come up with we could provide our people with technologies which gives biological data and constant feedback? Continuous glucometer in diabetics, I struggle and my colleagues struggle whole day to make sure the patient get it. Patients who get these continuous glucometer just by having a 24-hour feedback, not changing in their medication, they have controlled your sugar because they have a feedback now. They understand how their activities affect them. If they exercise, how the sugar go down. If they walk, how it improves. And then if they screw up and eat wrong, they see the sugar went 300. You do not need to treat them. The technologies are there. Everybody who has a chronic disease, if you're diabetic, you must have a continuous glucometer. You must have a weighing machine. You must have a automated blood pressure machine and pulse ox. If we can come up with a system providing variables and available things which are giving real-time biological feedback to our patients, we could ask for significant change and it will save health. In our office, I did an experiment that for 100 patients who are sick, as I said, we do value-based care. As a small practice, we cannot afford to provide everybody with this thing. Patients who are on Medicare Advantage program, they have some over-the-counter benefits. We use some and we subsidize some. And we were able to get everybody with weighing machine, which is digital and syncs with their phone, glucometers if they were diabetic, pulse ox, and the blood pressure machine, and let people just take care of the things on daily basis. Just they know if a patient of heart failure, their weight went up by 3 pounds, and they have the tool and just have to push one button to get a physician and get the medication adjusted or whatever needs to be done to be seen or done part. That's how we will take care of that. Our problem is 7 deadly sins. Those are the root cause of all chronic medical problems. Let's explore. Pride, greed, lust, envy, gluttony, wrath, sloth. Those are our lifestyle and behavioral changes. What are the lifestyle changes which are contributing to chronic medical problem? Each human being must understand what they are. Each human being has a body, they have a mind, they have emotions. So everybody has a body, everybody has emotions, everybody can think analytically for them, understand the information. Everybody has a personal GPS, which is your spiritual domain, and everybody is embedded into a social environment. So the whole autobiography of each human being is your body, your emotions, your thoughts, your spiritual domain, and your social. And your social domain is made up of 5 things: other people, places, things, event, and time. That encompasses everything. If we are trying to make policies, we must take care of all 5 domains. At the level of body, we are eating very poorly. We do not move, we smoke, we consume a lot of alcohol and other recreational drugs. That is gluttony and sloth. Environmental factors, air pollution, toxic chemicals, all of these are contributing. But really how much? If you are healthy at an individual level, that you eat good, you exercise, and you don't have any vices, environmental factor will not affect you unless you happen to live near an industry plant. Genetics and biological factors. Genetics is a blueprint. Unless somebody write on it, your genetics doesn't do anything. If you have some genetic predisposition, you must have bad habits associated with it. Not all the time, but most of the time. Otherwise, you will die. Genetics does not affect you. Social determinants of health. America is not same. Even in smaller communities in a 10-mile radius, based on socioeconomic status, access to health, and mental health, we have different America. They have different healthcare needs and they have different healthcare outcomes. Social determinants of health play a major role. Afro-Americans in the inner cities don't have access to care due to socioeconomic status. They are the ones who have highest risk of mental health. This is a cycle. That's where our lawmakers need to understand and come up with the policies. And the policies where we don't create pests on the system, the policies which improve health, improve their emotions, improve their body, and make them intellectually wise. Behavioral factors. We shouldn't smoke, everybody knows. We shouldn't drink excessively or at all. Sleep. Nobody talks about that. Sleep is not a passive process. People who do not sleep, they have all-cause mortality high rate. Two processes, metabolic syndromes and inflammation, is the mother of all chronic medical problems, whether it's diabetes, hypertension, arthritis. We are overfed and undernourished. We are eating a lot of empty calories with no nutrition. Our food is devoid of fiber, vitamins and minerals, quality fats and quality proteins. We are imprinting our children at a young age during school lunches with pizza, Pop-Tarts, soda, juice, and imprinting those young brains that's nutrition. In addition to individual responsibility, policymakers must understand that overprescriptions. Medicine 2.0, where we have studied all the medical processes and we come up with either pill or a procedure for all of your problem, that is not taking care of you. We are overprescribing medication because patients will not do what it takes to be done. There is not a day I don't meet somebody in the office, even at advanced age, in 80s, 85, where they had 85 years of unhealthy lifestyle. Even at 85, they decide that we are going to get better and they start improving their health and they make the changes. And they look 70, their functional level comes back. It's never late. Eat food, don't junk. The risk factors, which we talked about, they lead to chronic medical problems. Obesity, hypertension, diabetes. Smoking leads to COPD. All of them must be managed in addition to lifestyle modification with the proper medications. There is a lot of unnecessary discussion about the medications. Unless you change your body, mind, thought, spirit, and social environment, the medication is your best friend. But because individual responsibility does not exist, you are not taking care of yourself. You will need medication and you should take the medication because that's the only way you could prevent complications from chronic diseases. That is where we are spending 97% of $3.8 trillion every year. What is the solution? We must promote healthy lifestyle. We must treat chronic medical problems till we could correct them with proper lifestyle. We must treat to the target. And God forbid if you have crossed the limit and you have complications from these chronic diseases, we must do everything manage you, make you safer, and take care of you. Error lies both on policymaker sides, healthcare delivery model, physicians, irresponsible patients who are not taking their own responsibility, and society in general. Our problem is prosperity has made us hubris, and we are not taking care of ourselves. We believe pill or a procedure will take care of that. That's how mighty fall. We are a mighty country. If we do not change, we do not improve, we will fall. A real solution: change your lifestyle, prevent chronic diseases, and prevent the ultimate complication of chronic medical problems like heart attack, stroke, and other forms of disability. You will enjoy a long lifespan and health span. I hope I've convinced you that you could improve your lifestyle at any age, because I've seen even in advanced age, people change and things become beautiful. I will link all the preventive care videos in this playlist. Please watch them, like, share, and subscribe to our channel, and I will see you in next video. Thank you very much.